Welcome back to the channel. In today's lecture-style podcast, we're diving deep into how aligners are used to correct different orthodontic discrepancies. Clear aligners are not just an alternative to braces, they have their own set of biomechanical strategies and features designed for specific problems. From Class 2 and Class 3 corrections, to crowding, spacing, vertical discrepancies, crossbites, and even impacted canines, aligners have evolved into a comprehensive orthodontic tool. By the end of this episode, you'll understand not just the what, but the how aligners actually work to fix these issues, and the clinical pearls you need as a future orthodontist. Section 1. Class 2. Malocclusion. Class 2 malocclusions are one of the most common problems in teens and young adults. Aligners address them with three key tools: precision wings on Invisalign Teen, which mimic twin block appliances, posturing the mandible forward while simultaneously aligning the arches. Class 2 elastics, attached via precision cutouts or bonded buttons, delivering intermaxillary forces that distalize upper molars and pull the mandible forward. Sequential distalization, where aligners move molars backwards step by step, making room for premolars and canines. Clinically, the most effective strategy combines both dental and skeletal correction, around 2/3 dental movement, 1/3 mandibular advancement. Section 2. Class 3. Malocclusion. Class 3 malocclusions are more challenging, but aligners can help in several ways. Class 3 elastics, attached with cutouts, pull upper teeth forward and lower teeth backward. Sequential lower distalization, where lower molars and premolars are moved distally one at a time. Hybrid treatments using TADs for anchorage, making tooth movement more controlled and predictable. For younger patients, aligners can act passively with elastics, avoiding bulky face masks. For adults, they provide aesthetic alternatives to surgery-assisted cases. Section 3. Crowding and spacing. Crowding and spacing are bread and butter orthodontic issues, and aligners handle them well. For crowding, aligners create space using IPR, interproximal reduction, or by digitally expanding the arch and sometimes distalizing molars. For spacing, aligners close diastemas by bodily moving incisors and premolars, often with optimized attachments to control root position. The key is digital staging. Movements can be planned sequentially or en masse, and overcorrection is often built into the plan to counteract aligner elasticity. Section 4. Deep bite. In deep bite cases, aligners use their unique occlusal coverage to advantage. Anterior bite ramps built into aligners disocclude the posterior teeth, allowing them to extrude while incisors are intruded. Aligners can intrude incisors predictably up to 2 to 3 millimeters. In teens, growth helps eruption of posterior teeth, making deep bite corrections more stable. Bite ramps and vertical elastics make this correction more predictable compared to braces. Section 5. Open bite. Open bites, often linked to habits or vertical growth patterns, are another area where aligners shine. Aligners naturally intrude posterior teeth thanks to their occlusal coverage. This auto-rotates the mandible, closing the bite. Anterior extrusion is enhanced with vertical elastics attached to aligners. Braces often struggle with open bite correction, but aligners use their intrusive forces to close the bite efficiently. Section 6. Crossbite. For crossbite cases, aligners can expand arches by tipping or bodily movement. Mild to moderate crossbites can be corrected with expansion programmed into the aligners. Severe skeletal crossbites, especially in kids, often require a Hyrax expander first, followed by aligners for refinement. This combination allows both skeletal and dental correction. Section 7. Impacted canines. Impacted canines require creativity with aligners. First, aligners digitally create space in the arch. After surgical exposure, an elastic chain or button is bonded to the canine. Aligners are designed with hooks or cutouts to engage the elastic and gradually guide the tooth into place. This process often requires a multi-phase protocol: space creation, surgical exposure, and traction with aligners. Section 8. Retention. No treatment is complete without retention. Clear retainers like Vivera or Essex are widely used, aesthetic, and comfortable. For deep bite or transverse corrections, Hawley retainers may be more stable. Lingual bonded retainers are also common for anterior stability. The key message: aligner therapy doesn't end with the last tray. Retention is essential. So, to summarize, Class 2, elastics, distalization, and precision wings. Class 3 allelastics, distalization, sometimes hybrid with TEDs. Crowding spacing. Cicatabia expansion, IPR, bodily movement. Deep bite, bite ramps, incisor intrusion. Open bite. Posterior intrusion, anterior extrusion with elastics. Crossbite, no expansion with aligners, sometimes combined with expanders. Impacted canines. Space creation, surgical exposure, elastic traction. Retention. Clear retainers or Hawleys for long-term stability. Clear aligners are no longer just cosmetic tools. They're versatile, powerful systems that can manage almost every orthodontic discrepancy when planned correctly. Thanks for tuning in. If you found this helpful, make sure to like, subscribe, and share with your classmates. And stay tuned for our next lecture.